agradecer à comissão organizadora, em especial ao professor Daniel, pelo convite em fazer essa moderação. Então, nós vamos dar início à palestra do professor David, que tem o título Assessing Researchers for Hiring and Promotion, Should We Use Best Publication Practices? I would like to call on the stage Professor Moher. David Moher is a senior scientist in the clinical epidemiology program at the Ottawa Hospital Research Institute, where he directs the Center for Journalology. Dr. Moher is also an associate professor in the School of Epidemiology and Public Health at the Faculty of Medicine, University of Ottawa, where he holds a university research chair. Dr. Moher holds a Master's of Science in Epidemiology and PhD in Clinical Epidemiology and Biostatistics. Dr. Moher has been involved in developing the science of how to optimally conduct and report systematic reviews for most of his professional career. Another part of his research has focused on how to best develop reporting guidelines, and he spearheaded the development of the CONSORT and the PRISMA statement. He has been actively involved in the development of many other reporting guidelines as is part of the Equator Network. Dr. Moher leads an active program investigating predatory journals and publishers. He's actively developing a program to investigate alternatives to current incentives and rewards in academic medicine. David, you will have 30 minutes for your presentation, and after that we'll open for questions and discussions for 15 minutes, okay?
So, bom dia. That's almost my total Portuguese. So, thank you for inviting me here. Thank you to Daniel and the team for making my visit so fun. And I'm going to try to convey a story to you over the next 30 minutes. And probably most importantly is to engage you in some questions. So the first thing I want to do is to give you some disclosures. I received some money from Biomed Central for a tough job. And other than that, I don't have any real or perceived disclosures to share with you. So I wanted to start with sort of my story. Probably one of my first publications was looking at how people reported sample size in randomized trials and whether there were enough people in the trial to make a conclusion about the result. And what I showed was that actually even in the early 1990s, so more than 20 years ago, that people did not have enough people in the trial to make a definitive conclusion most of the time. So if we move forward to look at this issue in 2018, we can see that there's almost no progress. So 20 to 25 years later, people are still committing the same sins. They're asking participants to become volunteers in randomized trials when those randomized trials do not have enough people in them. So they are committing really a type 2 error for those who are statisticians. Now, if we think about systematic reviews and we look, we also have problems when we see, this is a typical systematic review, when we have yellow and red, unclear risk of bias or low, high risk of bias. Again, these are based on individual primary studies that are being pulled together, collated in systematic reviews. So we have a wall of red and yellow, almost no green, and green is good. Yellow and red are bad. So this is what you and I were all publishing this. And our center does a lot of work for the Canadian Task Force on Preventive Health Care. And if we look at a recent clinical practice guideline for breast cancer, what we can see is that we can say almost nothing because we have very bad evidence. It's low-quality evidence. We cannot make any meaningful result. So this, again, is what all of us are producing. We're producing research, publishing research that is unusable, unreliable. And I think if you look at comments from systematic reviewers, what you see is examples, observations of enormous waste. We were unable to use most of the information we collected. And so this is scientifically and morally, it's very problematic. And in 2014, The Lancet produced a series, Waste in Research. And the editors wrote an editorial really highlighting that we ought to take this opportunity to reflect on what we're doing and how we're doing it, and is it useful, or do we need to rethink how we're doing things? And what I think we see, if we look overall across the literature, we see that there are some significant problems in biomedical research. We have a reproducibility crisis. We have a crisis in selective reporting, which is people not telling us the truth. We have problems with spin. People are not being objective. Scientists who are trained to be objective are not being objective. And so we have a tremendous amount of evidence. We have people publishing in fake journals. And so, this is a problem that is not going away. And so I began to think about this quite a few years ago, and wondering how can people advance their careers with this rubbish? How can that be? And what is going on that sort of enables this behavior? And I think what it has something to do with is how, what incentives and rewards are used to promote people's behavior. And if we look at a typical example of a university, this is a University of North Carolina, what we can see is their interest is only one thing. How many papers can you publish? Can you publish them in fancy, so-called fancy journals? And if you can do those two things, we don't care what the quality is like. We just want big numbers. And if you give us big numbers, even if it's rubbish, we're going to make you the fanciest professor in the world. We're going to promote your career. So this is perverse. It is extremely strange. Here's an example in Cardiff University where a colleague committed suicide, trying to get as many papers out as possible. So what is the university's response, the answer? The response is they put special locks on the window, not thinking, maybe we should have a conversation about our incentives and rewards. So the answer is much cheaper. I'll put a lock and we won't worry about anything, so people won't have to jump out of a window anymore. So what we did in our group is we wanted to see the universities, what their criteria were for promoting people. And I know in Brazil, the notion of tenure doesn't apply, and perhaps promotion doesn't apply too much as well. So we went and we tried to look at 170 universities around the world. We use a particular methodology that you can see here. And what we wanted to see is, do the universities promote what we call traditional? So traditional characteristics would be, David, publish as many papers as you can. And then we looked at what we call progressive characteristics, such as data sharing. And then we went and looked at all of these criteria. And what we found, of course, is, first of all, universities are far from transparent. That's a very important result that I think university leadership and hospital leadership need to reflect upon. But when we did examine criteria, what we found is that we have evidence now that almost no university uses progressive criteria. So if you're a good scientist and you want to share your information for notions of reproducibility or other reasons, you get no credit for that. That's a good behavior for which you get no credit for. What you do get credit for is having something in a high journal impact factor, which is meaningless, it's useless, it has bad mathematics, it doesn't make no sense. That's what is going on around the world. So we started to work in this space, and I want to share with you that we are not the first people, we are not going to be the last people, and we're not the only people. So there's a number of activities going on in the UK, in Europe, and globally. And people should be aware of that we are not the first. For example, in the Europeans, the Leiden group have come up with some criteria that you should think about if you want to be progressive and you want to sort of participate positively in the world of biomedical research. The Declaration on Research Assessment, DORA, has made it very clear that universities and research institutions that are assessing researchers should not use the journal impact factor. It's very clear. And there's lots of things that institutions could do, this institution can do, and individuals in this room can do today. And I'm going to come back to that. So these are important activities, and we ought to keep a close eye on them. And also, a colleague of mine, Frank Miedema, who was the Dean of Medicine, Utrecht, basically said, look, we're going to throw out all of this rubbish about journal impact factors, and we're going to have a conversation as a faculty about what criteria are important. So, for example, should we have reproducibility as a criteria? We need those discussions. And very early this year, the University of Ghent, a very senior leader, also indicated that their university are going to throw out the traditional ways of assessing researchers. So we developed, or started to develop, the Hong Kong principles. So approximately 18 months ago, myself and Paul Glasgow made an application to the World Congress on Research Integrity that we wanted to look at promotion and tenure in the context, in the prism, in the line of research integrity. Is it smart to carry on in the traditional way, or should we enhance research integrity? The committee were extremely interested in what we were participating in, and they invited us to do several things at the World Congress of Research Integrity, which was held in Hong Kong this year. It included plenary sessions, it included breakout sessions, and we had involvement in at least 100 people who participated in this effort. And so we developed Hong Kong principles, which are 5 principles. These are the principles. You can look at them on a preprint at the moment, and you can see. And I'm just going to share with you a couple of examples of those principles. So one of those principles, which I can't read too well from here, is value the accurate and transparent. So we're interested in transparency. And if you look, for example, at the Wellcome Trust, which is a very large funder, and they have the Wellcome Open Research, and they require the use of reporting guidelines. If you're developing a protocol, for example, for a randomized trial, you need to use a reporting guideline. If you're reporting the results of a randomized trial or preclinical research, you need to use reporting guidelines. That is a requirement of the funder and their in-house journal. And other agencies do that. So in the preclinical world, the NC3Rs do it, the Gates Foundation do it. So there are funders who are doing this. And so we should reflect on our colleagues who are funders to see whether this interests them, whether they feel they can participate in this. And of course, if you want to know about reporting guidelines and being transparent, you would go to the Equator Network, where all of the reporting guidelines are available, importantly, free and in an open access manner. So people cannot use the excuse, so we can't get it, it's behind a paywall. Go to the Equator Network, and the Equator Network has many other fantastic resources, and I know that a group will be delivering a workshop tomorrow on reporting guidelines, so I'm not going to spend too much time. We know that, again, a funder in the UK, the National Institutes of Health Research, which is a major funder in the United Kingdom, they are requiring registration of studies. So again, can funders do this? And can institutions that are home for, thank you, can institutions that are the home of researchers, can they demand that their researchers register the studies? Can they demand that researchers use reporting guidelines? Well, one way they could do that is make them part of the the criteria for promotion and tenure, and not worry about journal impact factor, which is meaningless. Our institution and other institutions are using a tool called SEPTRA. And SEPTRA is an online guide to developing protocols for randomized trials. Now, what's really nice about this is that when the researchers have finished their trial protocol and they press the button, it is automatically registered on clinicaltrials.gov. So it's a way of an institution, and indeed a funder, of using best practice with very little effort. So, you know, again, is this something that institutions in Brazil are interested in participating in? And also something that Doug Altman and I wondered about, which some journals are now using, is a declaration of transparency. It's very sad for me that in 2019 we're asking researchers to simply tell us the truth. What did you do and what did you find? And I don't know why we have to do that in 2019. But again, could we use this as a characteristic for promoting people? Could we ask the research community that any time you're submitting a protocol, a completed study, that you also sign a declaration of transparency? So we also have another principle is value open science, open research. And we know, this is a beautiful paper by Michel Mello, we know that patients want this. And there's quite a lot of research showing that patients are quite enthusiastic overall about having their information shared. So could we use this as a criteria for promoting people, that your data, your information is to be shared, is available? That will definitely be useful in the world of reproducibility. So we have some data, some evidence that it's not simply me and a group of people saying, you should do it. We actually have evidence to suggest that actually sharing data will increase citations. And actually, an institution might be quite interested in citations because that will help spread the word of the research and the researcher. So if you, I'll give you an example again of where you do not need to be a rich university, a rich hospital. You can be small and do meaningful things. So this is the Delft University of Technology in the Netherlands. It's small. But what they've done is they've taken the idea of data champions. These are people who will help researchers make their information available for data sharing. And they don't have to be authors on a particular paper. But if they've done that, they can use that information of being a data champion towards their promotion and their tenure. So again, can we think of Brazilian institutions that will want to use this as a criterion for promotion? I hope so. I think our Hong Kong principles are filled with examples of implementation. I'm not here to say to you that, you know, these are perfect principles and you must do it. What I'm here to say is think about them, and there are many, many examples of where they are being implemented, such as the Delft, the University of Technology, and the University of Toronto that have implemented SEPTRA. And so there's many, many examples, and you could see whether they resonate with you. We are thinking of how to disseminate this, and we're working on putting this into multiple languages. Certainly, we would very much like to collaborate and make sure it's in Portuguese. I think that I could probably say quite a lot more about implementation, but I'm not going to spend too much more time on that. Implementation is complicated. It's not to be taken for granted, but I think it requires collaboration to see whether it can be meaningfully done. And I think we need to think about implementation from the very beginning and as we go along. I think what I'm asking here is essentially is whether this institution, whether there are other institutions, whether they're at a university, whether it's a hospital, can they come on board? Do they see this as a positive step? For example, does this university want to sign DORA? It would make a strong signal to the community about their rethinking. How should we promote the career of people? Aside what the institution can do, you, for example, could leave here or be on your computer now and individually sign the DORA. That's what you could do. And you could obviously try to get your institution to do that. You could certainly think about that in terms of the Hong Kong principles. For example, the Nuffield Centre of Bioethics in the UK, they have written to me in the past month, and they have endorsed the Hong Kong principles because they see this as an important step forward to make sure that institutions are enhancing their research integrity through the process of advancing people's careers. Let me see here. I think, because I can't see too well, there are many ways for institutions to think about being transparent. And I think here are just some examples of that, and I hope that institutions and individuals who are leaders in those institutions might want to think about this and think about it. Is it a way, is it a path forward? One way I believe that is a practical path forward is to take the top process. The top process is about trying to improve transparencies at a journal. So there are a number of levels that a journal can declare how transparent it is about its activities. And earlier in my talk, if you see that I mentioned that most universities we see are not transparent about this whole process. Could we take the top approach and adapt it for universities and for hospitals? So you can see here I've used an example of one of the Hong Kong principles, and here might be what a university or a research institution would say. They would say, well, actually, we're not going to do very much. And at the other extreme, they're going to say, we're actually going to do quite a lot about this. So again, this is not something that we, the developers of the Hong Kong principles, want to tell you what to do. What we would like to do is work collaboratively to see whether this resonates with your institutions here, locally. Implementation has to be local. It can't be global. And if it resonates with you or some aspects of it, then let's work collaboratively to see whether we can adapt TOP for academic institutions. Because I think transparency is incredibly important, and we need to make sure that not only Do we promote people who are transparent, who want to share data, but as an institution, we need to get on board and promote that. That is really enhancing research integrity. And most institutions that I've spoken to feel quite strongly about enhancing their research integrity. So I do think, though, we also need, of course, systematic reviews. And why I mention that is, even though there are many implementations, the question that I always ask myself, do they work? Am I going to ask somebody to take a drug if it doesn't work? Well, of course not. I'm not going to ask anybody to take surgery if there's evidence it doesn't work. So we need to see, do these implementation strategies work? The ones that work, we need to work hard at making sure they're implemented. The ones that don't work so well, we need to tweak them to make sure that they work better. So I want to share with you an example of, this is a well-known psychology journal, Psychological Science, and they implemented badges for people who registered their studies. They got a registration badge. So this group of researchers, what they did is they looked at the first 27 badges, groups of researchers who would receive their badges, and they looked to see whether their pre-registration matched the published report. And what they found in 26 of the 27, it did not. So it suggests that at Psychological Science, there is no audit and feedback. The journal simply said, take the drug, in this case, take the badge, but they've not seen whether the badge works. So we know from at least this piece of research that the badge doesn't seem to work because there seems to be differences across the board in adherence to the pre-registration plan, such as the question, such as the sample size, such as the analytical model. So we need to tweak that. So institutions that are going to implement changes need to build in audit and feedback. And there is a lot of evidence that audit and feedback work. It's not expensive, but it works. And I think this is my second last slide. This is from the chief scientist of Australia. I think it's important that we need to revisit how we advance people's careers. And I will just leave you with this last slide. And I don't know how to say thank you. I have it written down here, but I can't say it in Portuguese properly. Richard Thaler is an economist. He's also, of course, a Nobel Prize winner. And the paper that led to Richard Thaler's Nobel Prize, as you can see, was rejected multiple times. So we need to think of other ways of advancing people's careers other than simply getting a publication. Thank you.